Hi guys, thanks again for watching. Talia White, proud practical nurse and student registered nurse. Um, Here again with the Colin BP-S510. Wanted you to get a good look at the operating mechanisms. Um, so let's go. Without further ado, go ahead and power this bad boy on. It's going to load up here, and it only takes about 3 seconds, 3 to 4 seconds. You see our light is lighting up. That light is an alert to let you know that something's going on. Either the machine is not getting the input data that it needs, um, or something like that. But as you can see, it does have an information banner here that'll tell you if something is wrong, okay? So it's telling us here that the temperature probe is disconnected. Check the oxygen sensor probe. It actually takes it's two different probes for the temperature, which is really good. It's also telling us that the ECG leads and electrodes are not attached. So it communicates and helps you provide the best care possible for your patient, which is really great. I like the fact that this alert lights up from the back as well, because even if you're sitting at the nurse's station and you might not be able to hear the machine, you can or if you walk past your patient's room, you will notice that that light is lit up and you'll know to come check. So check your patient out. All right, so let me go ahead into the different this way, and then I'm going to go into operating the actual machine. Like I said, the O2 sensor, the oxygen sensor, temperature probes, EKG leads, and electrodes, those do not come with the machine. And so you will have to order them either, independently, or you can order them through Walmart medical supplies. You can order them through us, okay? And for a small fee, we'll have it shipped directly to you. All right. This button here, this mechanism here, just tells us to, just tells the machine to quiet the alert. And then this button here, sorry about that, just give me a second. This button here will get the blood pressure cuff inflated and started. Now, when you push this button, what's really cool about it is you can set the intervals that you want the machine to take your blood pressures. So say for instance, if this is a acute patient, they have something going on, they're very, very sick. Let me push it again so you can see it. Oh. And that's actually the operation of the blood pressure cuff. So you can hear it going off. Okay. This button here just stops it or starts it. Okay. And as you see here, you have the systolic. It takes the map, which is a nursing thing, or doctor. This is very vital information for the doctor. Okay, this map, and then the diastolic. It also gives you the history of what it was before. Okay, 200/70. Ooh. Okay. So, I'm just wondering if this is the highest that it'll pressure will go. I don't. Yeah. So anyway, this is how you set it to go at different intervals. Okay. So you push that, and then this comes up. You can do it every 15 minutes, 20 minutes, 30 minutes, 45, and so on. Right. And like I said, this is good for the really sick patients who maybe you might have to get their blood pressure every 15 minutes or so. Okay. Now, let's stop it. This is how you would start to inflate the blood pressure cuff and how you would stop it. Or not just the blood pressure cuff, but everything. Everything will start to collect data once you go ahead and push that button. And like I said, the temperature has 2 probes where, you know, you could take a temperature. You have more than one option to take a temperature. I'm not really sure why or how that, but that doesn't mean it's not valuable. Okay. So if you look down here, you have the time and military time. You have the little alert bell here if something's going on. Here you have the settings. You can make your screen, point out to you, stick out to you a little better. Now let's show you how. Okay, so this button here will tell you the history. Okay, this will tell you the history of your blood pressures, your heart rates, your oxygen, respirations, temperatures. This, if you needed to go through here, it collects all that data for you. Okay, really nice machine. So this here is our paper roll, and it actually prints off the information. I'm going to set it up so you can see how this goes. Paper. And I appreciate you guys' patience with this whole thing. I know it's not the most entertaining video in the world, but it's great. It's a great machine, and it has so many uses that can inform you about your health, the status of your health. So it's important to maintain that knowledge. So I think it just goes this way. I'm not sure. Let's see. Let's try to print something and see. And I apologize for how dark this video is too. It's pretty dark. And I might end up redoing this video just because it's kind of shaky and everything. So you can set this bad boy up with all kinds of stuff. I'm even impressed by and this will print out your EKG, all your information on a receipt. That way you'll have it. Okay. Okay. Just tear that off, put it in your pocket, take it with you when you do documentation or whatever. I don't know. You can pull it out. Got an EKG strip. You can tack that on to the patient's chart for the doctor to look at and make his or her adjustments if needed. So if you turn this knob here, you can go to the different boxes, and then you just push it, and then it'll give you specific information according to that. Like this is the oxygen sensor. Okay, this will alert if the oxygen, we want our oxygen between 90 and 100. C-lock. Okay, let's return. So that you can go down and, respirations, apnea alert. That should always be on. Okay. Apnea time setting. You know, how long are they apneic before it goes, the machine starts to warn you. Okay, temperature. Now we get to the good stuff. You can set the time. Okay. Okay. Let's get out of here. You can set any alarms. You can go into your settings here. Set the patient mode. Is it an adult? Is it a kid? Okay. This machine is great. It does it all. Great for students who, great for schools who want to teach the students how to recognize these things. You know, one thing about medical school, it's a hands-on approach, and so the book work is great, but you got to be able to touch and feel these things to get comfortable with it. You don't want to wait until you're actually um, there in front of a patient to figure this stuff out. So, you know, even for those reasons, it's great to have. Okay. I'm trying to see how you could. Because this screen here gets bigger. I'm trying to figure it out. So anyway. Is this it? No, that's not it. There's literally a way you can do that. But anyway, great machine. Um, Colin BP-S510. Thanks for watching.